Hello, welcome. My name is Dr. Meghan Norris, and my colleague is with me. She will introduce herself. We are both at Nationwide Children's Hospital Child Development Center, and we are really excited for the opportunity today to talk about practical support for neurodevelopmental conditions. And Dr. McEnoe Coons is going to start us off, so I will hand it off to her.
Hi, thank you for this opportunity to talk with you today. I have spent a good chunk of my career training caregivers, training other professionals on how to help individuals with neurodevelopmental disabilities or conditions be able to be as successful as they can in a variety of situations. So today, that is our goal, is to talk with you about increasing your understanding of neurodevelopmental conditions. I spend a lot of my time working with individuals with autism, so I may use the terms autism, neurodevelopmental disabilities, neurodevelopmental conditions interchangeably throughout. But we're going to talk about what those conditions look like and talk about what are possible challenges for those with neurodevelopmental conditions, particularly in times of emergency or great stress. And then we're going to talk about practical ways to help with that. So neurodevelopmental conditions is an umbrella term for several different types of conditions that we're going to go into a little more detail about. Autism spectrum disorder, I mentioned, is the one that I probably spend a good amount of my time dealing with. Also, intellectual developmental disorder, sometimes also known as an intellectual disability. ADHD, or attention deficit hyperactivity disorder. What we sometimes just call developmental delays or global developmental delays, and learning disabilities. So I'm going to start by talking a little bit about autism spectrum disorder. Individuals with autism spectrum disorder have challenges with social communication skills, and this will be really important to remember as we talk about where there can be some challenges in times of stress and what to do about it. Individuals with this condition often also have either repetitive or restricted or rigid behaviors. These can be things they do with their body, repetitive motor movements. This can be things they say, repetitive things that they say. These can be really restricted interests, like I only want to talk about this, I only want to play with this particular thing. Or this can be rigidity with how their day flows. I'm supposed to be doing this right now. This is the only thing I'm supposed to be doing, which can result in some difficulties with transitions. Now, how the traits might manifest in any particular individual can really vary. The quote at the bottom there is one of my favorites. If you've met one person with autism, you've met one person with autism. So the way these traits play out can look very different person to person. And the language skills and intellectual skills of a person with autism spectrum disorder will influence that presentation, because individuals with autism can have anywhere from a very high intellectual ability to pretty profound delays. And obviously that will influence how they're going to be able to respond to instructions, expectations, things like that. An intellectual developmental disorder, or what some people call an intellectual disability, this is focused more on two particular areas of delays: deficits in intellectual functioning, or problem-solving skills, reasoning abilities, as well as deficits in adaptive behavior, which is day-to-day skills. So a person's ability to take care of themselves, engage in self-care, hygiene, ability to cook themselves a meal, ability to recognize danger, what's dangerous, what's not out in the community. And usually these delays are noted early within an individual's developmental period. And individuals with this condition will need some level of support throughout their life. How much support they will need really varies. There are various levels, anywhere from mild to more profound. Individuals with a mild intellectual developmental disorder, you might not notice right away. And sometimes that can cause discrepancies between what an adult or a caregiver expects a person to be able to do and what that person with an intellectual developmental disorder is actually capable of doing. Now we'll talk about ADHD, or attention deficit hyperactivity disorder. These are individuals who have difficulties with what we call executive functioning skills, so organizing themselves, planning. I like to say individuals with ADHD tend to live in the now. It's kind of like they have blinders on. They're not thinking about what's next or what's coming all the time. They struggle with attention skills, they have trouble focusing, they might be daydreaming. Not all the time, I should say. It's not a pervasive attention deficit, but particularly when things are mundane, not of interest to the individual, that you see the symptoms come into play more. Also, the hyperactivity aspect is referring to being fidgety, wanting to be in constant or frequent movement, and overall having a high energy level. So, sitting still for a prolonged period of time might be difficult for an individual with ADHD. And you see symptoms of impulsivity. So it's very common for individuals with ADHD to act before they've thought through, is this a good idea or not? They might interrupt. They might have trouble waiting their turn. For example, if they're in a line, it might be really hard to wait for their turn. So we're going to talk a little more about some things to think about with individuals with any of these conditions, and I'm going to turn it over to Megan for this.
Thanks, Barb. So Barb gave a really nice overview of some of the different specific disorders or diagnoses that fall under NDCs. And I'm going to be talking more broadly about things that are common across all of them. So individuals with neurodevelopmental conditions are everywhere. And one of the things that's important to know is that there might not be any apparent or outward signs that this person has a neurodevelopmental condition. So again, people with autism, people with intellectual disability, there might not be any obvious indication that they are processing information differently or interacting with the world differently. Another good thing to know is that neurodevelopmental conditions impact everyone across social economic statuses, across ethnicities, across races and genders. So they are equal opportunity in that sense. Anyone could have a neurodevelopmental condition. And individuals with neurodevelopmental conditions often are more vulnerable at times. And that is due to some of the things that Barb was discussing. So people who are having communication challenges might not understand what other people are saying to them as well, might have trouble communicating their own thoughts and feelings, might have difficulty reading social situations and understanding other people's motivations. That puts them at risk for victimization. Additionally, people with NDCs can be medically complex. So there is a high co-occurrence rate of epilepsy, for example, in autism and intellectual disability. There also is there's a high prevalence of feeding difficulties, of sleep difficulties, and those conditions also can impact behavior and functioning on a day-to-day basis. They might also have psychiatric conditions or mental health conditions. So there's a much higher rate relative to the general population of anxiety and depression and other mental health concerns in those with neurodevelopmental conditions. And as we've already discussed in different ways, communication challenges are often quite common. So what does this mean in emergency situations? Can mean a lot of different things. One thing to keep in mind is that poor eye contact, diminished eye contact, inconsistent eye contact, all of those things can be misinterpreted as being non-compliant, not listening or paying attention, or even being somewhat combative. When the reality may be that eye contact could just be very uncomfortable for this person. Or some individuals with neurodevelopmental conditions might not realize that eye contact is an important cue to other people. So it might just be a misunderstanding in terms of how do we use eye contact. Additionally, as Barb discussed, particularly within autism, but not only within autism, routines and predictability can be very important for people with different neurodevelopmental conditions, particularly autism. So if you recall, one of the specific diagnostic criteria for autism spectrum is liking sameness, a need for sameness, that behavioral rigidity. And so when things change, particularly when they change unexpectedly, that can be really, really challenging for individuals with autism or other conditions. And it interrupts that predictability and what they're used to. That can be hard for all of us, but for those with neurodevelopmental conditions, it can be particularly distressing. And again, that might lead to behaviors that could be misinterpreted as aggressive. Engaging in repetitive motor mannerisms. So again, this is another behavior that we see commonly in autism, but also we can see in other developmental conditions like delays, like intellectual disability. This could include a wide range of behaviors, so pacing back and forth, rocking one's body, standing up and sort of rocking back and forth, flapping or moving one's hands in a repetitive motion. It might involve objects, so some individuals like to hold on to things that are maybe comfort items or just feel good to them, and might be very upset if they're told to put that down. Twisting objects, flipping objects in the air, all of these things are behaviors that we might commonly see in those with neurodevelopmental conditions, again, to a small extent or briefly, or pretty constantly. Those behaviors can increase during times of stress because for some people they're soothing. They're a way to calm oneself. If you see an increase in these types of behaviors, it might indicate that that person is distressed. It might indicate that they're excited. So strong emotions in general, good or bad, could increase these types of behaviors. Additional things to keep in mind is that people with neurodevelopmental conditions might have a tendency to wander off. So this is especially true in unstructured settings, and being aware of that is really important for safety. So the individual might not realize that wandering off or going to a different location could be dangerous for them, could be dangerous for others. They might not recognize danger in the same way that others might expect of them. Sensory experiences are also pretty important to keep in mind. So someone might experience pain differently or have a very intense reaction to a very small wound, like a paper cut, or have almost no reaction to a much more significant injury. So we definitely see children and adolescents who might have a broken arm and not communicate that and not really even be showing signs of pain that the rest of us, myself included, would definitely show. They also might have reactions to pain or other sensory experiences that are unexpected to some of us. So laughing, even if it does not seem like it's a funny situation at all to the people around them. And again, what's driving that is not anything malicious or a desire to I'm gonna wanna start this slide over because I'm having trouble with this point, just so you know. What am I trying to say? Nah, I don't like the word malicious. Unexpected reaction to sensory experiences. So I'm trying to make the point that it's not intentional. That's the word I want. There you go. Yeah. It sounded fine until I couldn't think of the word intentional. I don't like it when I can't think of the words I want. It frustrates me.
This way it gets worse when you get older.
I am older. Okay. Okay. So additional things to keep in mind during an emergency situation is that people with neurodevelopmental conditions might be more likely to wander off to unsafe areas or just to different areas that you're not expecting. They may not realize that wandering off could be dangerous to them and could be dangerous to others, and they may or may not recognize danger in the same way that many of us do. Additionally, sensory experiences can be pretty important to keep in mind. So people with a neurodevelopmental condition might experience pain differently than a lot of other folks. And that could look like having a very obvious injury, but underreacting to it, or what most of us consider underreacting. So we've definitely seen patients here that might have a broken arm, and their family did not realize they had a broken arm because they were not showing outward signs of pain. The opposite can also be true, where maybe a very, very small wound, like a paper cut, and the individual can have a very large reaction to that. The person also might show behaviors that are unexpected during times of danger or pain, things like laughing or humming or singing. Again, those might be driven by coping skills, trying to help themselves calm down, but they're not necessarily intentional in the sense of looking for a reaction from other people from those. And also really important to keep in mind is that sometimes these differences in behaviors and differences in how people are processing information can lead to meltdowns, aggression, and self-injury. And this is more likely, per the research, in people who have fewer communication skills and are less able to communicate their distress in other ways. So additional things to keep in mind that can be a challenge during an emergency given all of this information: sounds, smells, another sensory experience that we don't always think about, but smells can definitely be triggering for some people, and just being around a lot of people, because that comes with a lot of additional sensory input. That can be a challenge. Stopping the person or interrupting a current activity that they're doing. Some individuals with autism or other neurodevelopmental conditions really feel a need to finish what they're engaged in before they move on to something else. So needing to suddenly stop something can be very upsetting. We already discussed difficulties understanding danger, not understanding what other people are trying to communicate, particularly whys. Whys can be more abstract than a who or a what. So trying to grasp why I need to do this thing and why I need to do it now and what is the urgency, that can be very hard. Being upset by a new setting and new routines for a lot of the reasons we've already discussed. Even if something is safer or might feel more comfortable to some of us, the fact that it is different might be something that is challenging for a person with a neurodevelopmental condition, because familiar might be what feels safe to them. Trouble understanding how others might be feeling. Again, this is when Barb and I were discussing understanding other people's reaction, other people's emotions, that sort of reading the room type skill. And trouble understanding that we need to establish a new routine and how to make that happen for everyone in a safe way. These can all be things that are challenges. So I will hand it off to Barb for moving into some practical strategies that can help.
Thank you, Megan. So we're going to go through a variety of categories of different types of strategies that you can try, keeping in mind, again, every individual is different, and you might have to try out a few different types of strategies to figure out what's going to be a good fit with one particular individual. This kind of category we have labeled prepare ahead of time, like you would in many situations, not knowing when an emergency might occur and knowing how hard it can be to adjust. For individuals with neurodevelopmental conditions, it can be really good to be prepared and do some practicing. So one of the things that we would recommend is having, if possible, a go bag, a bag with things that can be soothing to the individual that they can take with them if they have to suddenly leave, suddenly stop doing what they're doing. This could have things like fidgets. Again, we talked about how for some individuals it's hard to sit still and not move. These could be soothing toys or objects. Megan mentioned that some individuals like to hold on to like a safe object, having things like that the individual would need, possibly having favorite snacks. We're going to talk in a minute about something called social stories, and I'll explain what that means. But basically preparing these ahead of time and going over them with an individual so that they understand here's what might happen can be useful. Practice drills, emergency drills, if and when possible, whether it's a fire drill, any other type of emergency drill. Going through the motions when it's not actually an emergency can be helpful for the individual. And also, some strategies we're going to talk about are to increase an individual's ability to label and identify their own emotions. Megan mentioned that it might be hard for some individuals with neurodevelopmental conditions to really understand what others are feeling, but also it might be hard for them to label and communicate to you what they are feeling. And what you might see instead are these meltdowns, tantrums. So if we can teach them ahead of time other ways to show and communicate how they're feeling, that might decrease the chance you'll see those unwanted behaviors. So I mentioned social stories. There's no right way to do these. There's a variety of ways you could consider doing this, but it's basically a short and simple story that will explain to an individual what to expect in a certain situation and what to do. And this can be using pictures, it can be using words, it can be using a combination of the two, and it can be in any format. So some families, caregivers will have digital versions of social stories on their phones. Some will print and laminate. It looks very nice and fancy, but you can also hand draw it on paper. It does not have to be fancy. It can be done very quickly. And I would suggest to make the most use of these stories, to try to review them with the individual before you're going to practice a situation. And I'll show you an example here in a moment. While you're practicing the situation, to remind them, this is what we're doing. And then after you practice, to remind them, this is what we just did, this is why. As well as have it available to use during a real event, a real emergency. So this is just an example I pulled. Again, there are many examples that you can find on the internet of a social story for a fire drill. And you can see this is an example of using a combination of pictures along with words. And I recommend considering using pictures as much as you can, even for children who have good verbal skills. We've talked about that there are a range of skills in individuals with neurodevelopmental disabilities. If you have an individual that is minimally verbal, it would probably make sense that you want to show more pictures to help increase comprehension. But I have found that it works even with individuals who have very adequate language skills, remembering that the more we can take in through different senses, we see it, we hear it, we read it, probably the more it's going to stick with an individual. So to review this example, you've got a picture there showing a fire, and the words are, it's a fire drill, the alarm is on. In the next set of pictures, it's a stop sign and people in a line. And so we're explaining, stop your work and line up at the door. So again, you're trying to explain to the person what it is you want them to do. Then we've got some pictures that are showing, go outside, wait with your class. So we have a little clock with people sitting and other classmates pictured there. Then we're going to explain what the expectations are. No talking, be quiet, listen to the teacher. So again, we've got the pictures that show we're trying to be quiet, we're listening to what the adult is saying. And then a wrap-up line. When I have good behavior at the fire drill, my teacher is happy. And so the goal would be to go through this before you practice the fire drill so the individual knows what the expectations are. You can be looking at it in real time during the drill, and then you can review it after because you're hoping to help increase retention as well as comprehension. Now, this is an example of one possible way that you could work on increasing an individual's ability to either identify in themselves, label, or communicate to others how they're feeling. Where I might be able to say, I'm a little scared right now, or I am like super scared right now. That might be harder for an individual with a neurodevelopmental condition, or it might just be harder not because of their language skills, but because it's a time of great stress. And so what I'm going to show you in the next few slides are just some other ways to help an individual acknowledge how they're feeling and maybe be able to communicate it to others. So you can use, this is called like a 5-point scale. You could teach an individual, on a rating from 1 to 5. You could go 1 to 10. You could do it however you want. But teaching them that maybe a 1 means I'm very calm and relaxed, whereas when I get up to a 3, I'm getting a little nervous, and a 5 would be I'm about to explode. Again, you use the words that make the most sense for the experiences you've had with the individual that you're working with. The next one is similar, but it's also including some pictures, some visuals, which can be really helpful. Now, some individuals with neurodevelopmental conditions are not great at matching facial expressions with the feeling. So this might be helpful for some, might not for others, but you're still using a point scale. You're also using colors, which we're going to talk about in a minute, as well as the facial expressions. And maybe you have this, again, in digital format on a phone, maybe you have it printed off, and you could just ask the individual, can you show me? Can you point and show me which one describes you right now? And that will just help increase the communication. Another option comes from a program that's used here a lot in the United States. It's called Zones of Regulation. It is a great way for individuals to not only identify and recognize how they're feeling, but realize when they're moving toward a place where they need to use some strategies to calm down. So as you can see from this visual, it's using some words, some pictures, but also some colors. And you can use the language of the visual to help the individual recognize, are they just in the yellow zone, which might mean they're a little worried, or they're feeling kind of silly and wiggly, and identifying a feeling there before they get to the red zone, where they might be very mad and angry, terrified, out of control. And so a question you might ask them once you've gone through this with them is, where are you right now? Are you in the green zone where you're super happy, calm? Are you getting to the yellow zone? Should we try one of our strategies before you get to the red zone? I'm a big proponent of prevention, and always trying to catch the individual before they get to the red zone is one of the goals. It's much harder to bring someone down when their emotions are kind of over the top. Some other strategies we're going to move on and talk about now are being really thoughtful about how you give instructions. So there's a couple different things we're going to talk about. One is using some first-then instructions, and I'll show you some examples in just a moment. But basically trying to keep things very simple for the individual, that your first direction is what you expect for them. Here's what we're going to do right now. Then is what happens afterwards. And we're not going to worry about anything else at the moment. And this gets at the second point here. In general, using fewer words. Give simple directions, fewer words. This is helpful for individuals who have less verbal skills and can sometimes start to tune out when they're hearing lots of verbal communication that they are not following, and you don't want them to tune out. You want them to get the essential instructions that they need to follow in an emergency. And this is helpful if you don't have as many verbal skills, but it's also helpful, once again, if you have lots of verbal communication skills, but you're very stressed out. And none of us, in times of great stress, process lots of information quite as well. So using very simple directions with fewer words, such as, walk fast with me. You're getting straight to the point, not hurry up, walk quickly, we are all in danger, you've got to put that down right now. That's a lot of extra words that you probably don't need. And again, the goal is you don't want that individual to start tuning you out. You want them to listen to the essential instruction you're giving them. Also, I think Megan and I both mentioned that it can be really hard if you've got an individual who's got some of those rigid characteristics where they feel like they have to finish something, it can be very hard to tell them to stop, or to tell them don't do that. It can be much easier to give them something that they can do. Here's what we can do, rather than I just want you to focus on stopping, and that can be hard. Here's what I want you to do. So maybe instead of saying, put your pencil down, you have to stop that, walk quickly and let's count our steps. You've given them something they can be doing. Also, using gestures. I mentioned when you use pictures and words and colors, you're trying to help increase the multiple modes at which an individual is taking in information. Using gestures can also be helpful, whether it's a be quiet gesture, it's a come on gesture, it's a stop gesture. You're just giving them an additional way to process information. In the autism world in particular, we talk about using visual schedules frequently, and I'll show you some examples of this. Looks a lot like the social story that we talked about. And again, it's another way that an individual can look at the expectations and remember, especially if you've got some problems with retaining information, short-term memory. You see this a lot in ADHD. You're giving them pictures to remind them, here's what's coming next. Here's what you're supposed to do. Giving choices can be very helpful. If you've got someone who feels kind of stuck, like, oh, I really wanted to finish this, giving them choices can help unstick them sometimes. So there might not be a lot of choices, like, do you want to come now or later? Might not be a choice. But saying, did you want to hold my hand or Bobby's hand here? Did you want to be first in the line or third in the line? So giving them choices where you can be very helpful. And giving warnings if possible. Sometimes there are no warnings in an emergency. There's no time for warnings. But if you even know 10 seconds ahead of time and can tell the individual, in 10 seconds we have to leave the room. Ideally, in 5 minutes, here's what we're going to do, in 2 minutes. But even a small warning of 10 seconds can help prepare them for a transition that might be otherwise difficult. So here I just put some examples of those first then visuals that I mentioned. So first then instructions can be visual. If you don't have visuals, you can also think about that's how you're going to use your verbal instructions. So first, we're going to hold the teacher's hand, then we're going to play with toys when we get to where we're going. First, we're going to follow the teacher, and then we're going to do some belly breathing if you've decided that's going to help them calm down. So the goal is to show them in a very simple format, here's what's expected, but we're also trying not to overwhelm them. First we're going to go here, then we're going to do this, and then I want you all to do this. You're just focusing on 2 things you want them to do in the immediate future. This is an example of a visual schedule for an emergency drill or an evacuation. So it's got multiple steps listed. You may decide for an individual you're working with, that's way too many, and that's okay. But this one has steps like, I'm going to stop what I'm doing, I'm going to line up, I'm going to go outside with my teacher, I'm going to walk to a safe space, then I'm going to stand and wait, then I'm finished, and I go back to class and I check my schedule. Again, that will work great with some individuals. That might be too much for other individuals. And just to show you that it doesn't have to be fancy, and that you don't have to be a great artist, as I clearly am not, I drew this visual schedule in probably 30 seconds, that you could just take a piece of paper and do a visual schedule if it will help an individual know what they're supposed to do. So in this one, I drew a stop sign, kids lining up at a door, we're following the teacher, and that's supposed to be an ear, that we're going to listen for what's next. So again, I'm showing you some examples that were professionally done. They don't have to be like that. And now I'm going to pass it back to Megan for some additional strategies.
We're almost there. So the next thing that we wanted to discuss was focusing on positives. This can be really hard in emergencies, but it's also hugely beneficial, and outside of emergencies as well, of course. So lots of praise can be really helpful in all sorts of situations. And one way to think of this is we want more praise, more positive attention than negative attention or correction. So you always want that balance towards the positive. And one thing that I think can be hard for adults sometimes in scenarios is finding that positive, particularly if there's a lot of other things going on, if you yourself are stressed, if you're trying to manage multiple things at once. So you might have to really intentionally do this and be thoughtful about it and practice it when you're not stressed, but looking for the positives. And there's almost always a positive. If it's one thing I've learned over my career, there is almost always something that you can give praise for, something that is going right. So great job putting on your backpack. Great job walking quickly. Thank you for listening to me. I'm so glad you're here with me. It doesn't have to be something big that you're focusing on. The point is trying to keep things positive, because most of us respond better to positive feedback than negative feedback. Using special interests to help. So this can be true particularly for autistic individuals, but certainly not only for them, in the sense that one of the symptoms of autism spectrum, as it's currently defined, is narrow or very passionate interests. So if someone has something that they are very focused on, very passionate about, you can use that to your advantage. You can use it to help in a stressful situation, because it's something that would be more likely to grasp their interest. So I bet Mario could get there quickly. Let's be like Mario. Or, ooh, do you think we could beat Mario there if he were here? So pulling in what that person is really interested in can be a way to try and motivate them. It can also be a way, again, to get their attention in the first place, to listen to directions. Can you whisper to me 3 things you built on Minecraft while we wait here? So again, this is a little bit also distraction, using that special interest to redirect to something that is perhaps less stressful or more enjoyable for the person, so that they're not focusing on whatever emergency or chaos or stress is going on around them. Now, these specific examples are a lot of words, so they might seem like not the best examples given what Barb just discussed with reducing words. Obviously, you can adjust these to the person. So again, everything we're discussing really still needs to be tailored to that individual, because we all have different skills, different strengths, different difficulties. But these are just to give some examples of how you could use a special interest. If you have access to a phone or some sort of electronic, putting on a video that person likes of their special interest could also be a really nice way to distract from other things going on around them. And then ignoring minor behaviors whenever possible. So if whining is going on, if verbal protesting is going on, we don't want to be giving attention to things that are negative behaviors, because in the behavioral world, one thing that is often true is that attention will increase a behavior. And that means positive attention will often increase a behavior, and negative attention will often increase a behavior, even though that might seem counterintuitive to some of us. But actually yelling or saying, stop, don't do that, that actually, again, it's more attention to something, and that can actually make whatever is going on happen more often. So we really want to ignore the behavior if we can, if it's not dangerous, if it's not causing a problem. And then again, redirect or focus on something else. So if someone is talking, but they're walking, you can focus on the fact that, great job walking with me, instead of saying, shh, stop, don't do that. And that's really, again, not only in emergency situations, but in general, what I would say is one of the most important behavioral principles. If you're only going to remember one thing, that is probably what I would encourage you to take away from this, is that focusing on whatever positive you can and giving attention to positive behaviors is going to be far more helpful in any situation than giving attention to negative behaviors. And that's true for positive behaviors and negative behaviors too. So it's just true in general, focus on the positive. We discussed earlier how important considering sensory factors are, so this strategy is remember that and do what you can to address sensory factors when you can. So for example, we already talked about preparation, but what are some things you can have in that go bag that might address sensory concerns that would come up? So many individuals, particularly those with autism, but again, not only those with autism, sounds can be distressing. They can be very sensitive to different sounds. Again, sounds that maybe many of us would find rather innocuous or not a problem, or we would adjust to pretty quickly. But having headphones, noise-canceling headphones, or headphones where you can be playing music or video on, that can actually be extremely helpful to some people when there's a sound sensitivity. Sunglasses are another one. So sensitivity to light could be, again, another sensory sensitivity that you might not think of a lot, but is very true for people with different conditions. And so just having sunglasses available to help block out bright lights might be something that works for a person. We all tend to be less happy when we are hungry and thirsty. Those are biological realities. So having snacks or drinks available for a person to address those setting conditions might be really beneficial as well. And I could probably go on and on about sensory needs, but I think that those are some really nice examples that come up more commonly. For some people, just being able to block things out, so even having like a hat that they can pull down might be beneficial to block out kind of, again, a lot of visual stimuli, or even just facing away from kind of additional people. That might be something that might feel kind of different for some of us, but for people who are getting overstimulated with visuals can be really beneficial. And then reminders, validation, redirection. So, just reassuring that like, yep, that's loud. Please use your headphones. It's okay to cover your ears. It's okay to turn around. It is hot in here. Can you name 5 really cold things? Or can you imagine Pokemon in a snowstorm? Again, pulling in that special interest. So all of these things can also work together, these different strategies that we're discussing. And as Barb was talking about, sort of transition warnings, like even if you only have a few seconds to do that, that's still something that might be beneficial. But if you have access to a timer, again, on your phone, on your watch, there's much larger visual timers that maybe you don't want to lug around, but you could. But that can also be really helpful for people too, to help with transitioning and to help let them know that this isn't going to last forever, hopefully. If you have that knowledge. All of these supports also come with ifs, so they might not work in every situation, and they certainly wouldn't work for every person all of the time. We also think it's really, really important, and we probably could do a whole separate talk on just this point, but those of you that are the adults trying to help in these situations, you are also human. You also have your own emotions and things going on, and this can be really hard. So taking care of yourself as much as you can in the moment is also a really important thing to keep in mind in stressful and emergency situations. So we are all reacting to what's going on around us, and children are often going to react to how we're reacting. So if we can, as adults, sort of monitor our own behaviors and responses and project calm as much as possible, that will also help the people that are around us, including people with neurodevelopmental conditions. Even if it may not seem like some of the folks are recognizing kind of, again, the emotions you're putting out, many times they will still pick up on it in some way. So taking care of yourself is important. You might need to just take a moment to reset. If there are other adults around, that could mean stepping away, saying, hey, I need a minute, and just, again, using some of the same strategies, honestly, that we're recommending for people with neurodevelopmental conditions. So it might be just shutting your eyes briefly. We'll talk about deep breaths on the next slide, and encouraging those around you to do the same. So taking care of yourself and taking care of the other adults around you is also really important during emergency situations. So one of the ways to do that, again, without needing extra stuff, is just deep breaths. Box breathing is one really good strategy for this. A 5, 4, 3, 2, 1 grounding exercise. So really just focusing on, again, sort of the here and now. What am I seeing? What am I hearing? What am I touching? What am I smelling? What am I tasting? Those are the 5 senses. So that can ground you. Again, that might have the opposite effect for some people, depending on what's going on in the environment and what you're smelling and seeing. But it could help some people in certain circumstances. And these are just a couple examples. Like I said, there's many more out there. If you know what works for you, just remember to do it, when the time comes. The same thing we said for practicing before, during, and after with what I would say patients or individuals with neurodevelopmental conditions. It's also true for you. So taking care of yourself is key. And practicing it before you need to do it, but also during, and then taking some time after, we would recommend. So I think there is probably a lot of other things we could say. I think one of the things that is interesting when discussing topics is that I always think as we're going through it, like, ooh, we could have talked about this or that. So one of the things I would stress, and then Barb will come up here to sort of give her summary, is we really are trying to talk about strategies that you don't have to go out and get extra training or buy a lot of stuff or do anything fancy. Whatever you have on hand can be used in some way to support in emergency situations, even if all you have is you. So some of these things are more involved, some are less. It's kind of a toolbox, and we want you to think of it as picking and choosing the tools that might work in different situations for different people. I think that things to keep in mind are to be clear, to be concise, and to be supportive. Remember that you're human, so just do your best. That's what all of us are doing, I think. And again, we really appreciate the opportunity to talk to you. We're really grateful for this chance, and we hope that what we've discussed has been helpful. And I'll ask Barb to come up, and she can add whatever she wants.
Thank you, Megan. That was a great summary. I was just going to add to it that I wanted to make clear something that I think we both indirectly said, that these are strategies that can work for all of us, the adults, the kids. So if you find yourself not knowing if an individual has a neurodevelopmental condition, that's okay. Nothing that we're suggesting would be harmful. There are many strategies we presented today that would very much help me in an emergency. So don't be afraid to try these things if you're not sure if someone has a certain diagnosis or not. These are things that would probably help all humans in emergencies. I will leave you with one of my favorite quotes, which is, most of us are doing the best we can with what we've got. And I think of that in terms of skills. So if a child's having trouble in any of the scenarios we described, it's probably because it's a skill deficit, not a motivational deficit. They're not doing it on purpose. So again, hopefully in some of the information we presented today, you'll find something that will work for those individuals that you're working with. And we thank you for your time. Thank you.